Hello, my name is Pharand, and today I'll be demonstrating an intramuscular injection. So to start off, we're going to look at our scenario that today is February 7th, 2021, and the time is 20:30. So we're going to start off doing our first check by just comparing the physician's orders to our MAR. So we're going to start with our name, Jake Nursing, PIN number 312-654-654-987-987. Date of birth, January 1st, 1960, and Dr. Skills Lab. So now we are going to see that the patient has known allergies and no known allergies. And then for medication, we have metoclopramide, 5 milligrams, subcut, daily, and to be given at 0800. And we will not be giving that medication right now as the time is 20:30. We also have diamond hydrogenate, 150 milligrams, intramuscular, and it should be given daily at 2100, and right now is 20:30. So we are within the half an hour time frame and it has not been given yet, so we will be giving this medication. And we can see that all our medication on our MAR is double transcribed by NURS signed. So we can go ahead and set aside our physician orders and we'll take a look at our drug monograph. So the drug monograph for diamond hydrogenate the classification is that it is an antiemetic, so mainly used for nausea. The maximum single dose of this drug is 100 milligrams. Now we are scheduled to give 150 milligrams. So in this case, I would call the pharmacy and our physician and just verify that they want to continue on with this dose of 150 milligrams. In this case, they're going to say yes, they want to continue with this dose. So we will be continuing on with the 150 milligram dose. As well as it says on the drug monograph that it can be administered IM as long as it's undiluted, which it is. So now we can set aside our drug monograph, and now that we have our information, we can start collecting our supplies. So I'm going to start off by washing my hands, and I'm going to look for my medication. So I'm going to look for diamond hydrogenate. So I can see that I have diamond hydrogenate here, and the dose is 150 milligrams. So I can check here that it's 50 milligrams per milliliter, so that means I'm going to need 3 milliliters to get the desired 150 milligrams that I need. It is to be given intramuscularly, and it says on the vial that it can be given IM intramuscularly, and the medication is not expired, so this is the medication we will be using. Along with the medication, I'm going to grab my supplies that I'm going to need for the procedure, such as the syringes and needles. So for this procedure, I'm going to be administering the diamond hydrogenate. And the supplies I'm going to need is a 22 gauge, 1.5 inch injection needle. I'm going to be using a blunt film needle, as well as a 3 milliliter Lurlock syringe. So now that I have all the requirements to administer this, I'm going to start off by grabbing my syringe. So I'm going to pull out my syringe, and then I'm going to pull out my blunt fill needle. This can all go in the garbage now. So I'm going to grab my blunt fill needle and attach the two. And once this is attached, I can set this down and I can go ahead and grab and clean my medication. So I'm going to grab my medication vial of diamond hydrogenate, and I'm going to clean the top of it with an alcohol swab. So I'm going to be cleaning the top of this medication for about 30 seconds. We're going to be cleaning it. So once it's been cleaned for about 30 seconds, we're going to say that is, we can go ahead and throw that in the garbage, and we will allow this a quick second to dry. And while that dries, we can pull up 3 milliliters of air, as that is how much is required to be pulled out of the vial. So we'll be pulling up 3 milliliters of air, and then we can uncap our blunt fill needle, and we can then inject our air into the vial. So we're going ahead to inject into the vial, and we'll be pushing our air inside of it. And then we're going to be pulling out the desired 3 milliliters that we need. So once we have the desired 3 milliliters here, we can go ahead and place our medication vial down, and we will recap our syringe. And once our syringe is recapped, we can go ahead and grab a pen or pencil or something hard and get out any excess bubbles in the syringe. In this case, we have perfect, there are no more bubbles. And once there's no bubbles, we can go ahead and remove completely our blunt fill needle and deposit it directly into the sharps container. And once that is deposited into the sharps, we can go ahead and grab our injection needle. So we're going to grab our 22 gauge, 1.5 inch injection needle, being careful to maintain the sterility of the tips, and we're going to connect the two together. So once these are connected, I can go ahead and prime my needle Now I'll be priming my needle to look for a small bleb coming up the top, and then making sure I have my exact 3 ml dose that is required with no bubbles. So now that I have my exact, if I make it focus here, I have my exact 3 milliliters that is required for this procedure. With no bubbles, I have my exact 3 milliliters. I can go ahead and start writing a medication label. So I'm going to start writing my medication label. I'm going to put the name, Jake Nursing, so initials JN. The drug name is diamond hydronate. I'm going to be putting the dose of 150 milligrams, 3 milliliter volume. As we can see that it is 50 milligrams per milliliter, so that's why we need the 150 milligrams in 3 milliliters. So the concentration is 50 milligrams per milliliter. The date is February 7th, 2021, and the time to be administered is 2100. Then my signature is C. Pharand, UMSN2. So now that I have completed my label, make it focus here. So now that I have completed my label, I can go ahead and start my second check. So doing my second check, I'm going to grab my label, my syringe, as well as my vial of medication and my MAR. And I'm going to start off by checking the name. So the name of the patient, Jake Nursing, JN. The medication is diamond hydronate, and we can make sure that we have diamond hydronate here, which we do. And then the dose is going to be 150 milligrams, which is 3 mLs. So we'll make sure that our syringe says that we have an exact 3 mLs, which we still do. And then we're going to check our vial. So the concentration here is 50 milligrams per milliliter, so that's why we can make sure that we need our 3 milliliters for our 150 milligrams. And then it is to be given intramuscularly, and intramuscular needle is attached, as well as on our vial it says that can be given intramuscularly, as well as on our drug monograph. And then it is to be given daily at 2100, and it has not been given yet, and as it's 2030 right now, we are going to give this medication. So once I've done my second check, I am good to go ahead and grab my supplies and go to the patient's room. So I'm going to put away my medication vial, and I'm going to grab my clean gloves, a alcohol swab, as well as a cotton ball. So once I have all of that supplies ready to go, I'm going to go ahead and enter the room. I'm going to perform an initial safety check, and once I have looked around, make sure there is no hazards, and there's not, I'm going to go ahead and introduce myself, say hello, my name is Cameron, I'm your student nurse from the University of Manitoba today. And once I've introduced myself and said hello, I'm going to ask if I can see their wristband. And I'm going to be comparing their wristband with my MAR. So their name, Jake, Nursing, and their PIN number 312-654-654-987-907, as well as their date of birth, January 1st, 1960, January 1st, 1960. Once I have compared their wristband, I will then ask them to verbally state me their name. So they will say Jake Nursing, and then their birthday, January 1st, 1960. And once they have verbally told me that, I'm going to ask them if they have any allergies. In this case, they're going to say no, they don't have any allergies, which matches our MAR saying no known allergies. So we are good to go. The next thing I will do is I'm going to tell the patient that I'm quickly going to do my third check with my medication. So I'm going to grab my MAR, my syringe, as well as my label, and I'm going to start my third check. So the name, Jake Nursing, initials JN. The medication we're going to be giving, diamond hydronate. The dose is going to be 150 milligrams in 3 mLs. So we make sure one last time that we have our exact 3 mLs that we need in our syringe, which we do. And then it's to be given intramuscularly, and we have our intramuscular needle ready to go. It's to be given daily at 2100, and as we said, the time is 2030, so we are good to give this medication right now. So once I have completed my third check, I'm going to educate the patient. So that I'm going to tell them that they're going to be receiving an intramuscular injection of diamond hydronate. And this diamond hydronate is an antiemetic, mainly used for nausea related to the chemotherapy. Some side effects they might experience during this medication are going to be dizziness, drowsiness, headache, anything of that sort. So I will tell them if they experience any of those to just let me know so we can assess further into that. As well as before the procedure, I will be taking some assessments. I will be taking their vital signs. I will be assessing their level of consciousness as well as their levels of nausea before the procedure. Now once I have done that, I'm going to landmark and pick the site I'm going to inject. Now because this is 3 milliliters, which is a larger volume, I'm going to be injecting it into the ventrogluteal muscle of the patient. Now to landmark for this muscle, I'm going to go ahead and place my palm on their greater trochanter. I'm going to angle my thumb towards their groin, my index finger towards our iliac spine, my middle finger towards our iliac crest, and I'm going to be injecting in between my middle finger and my index finger right into the ventrogluteal muscle. So once I have landmarked, I am getting ready to now give my injection. Now for intramuscular, you may have to, injections you may have to aspirate, although in this facility we are not required to aspirate during intramuscular injections, so I will not be aspirating for this demonstration. But just note, in some facilities you may have to aspirate. And now I am ready to go ahead and grab and put on my clean gloves. So I am going to don my clean gloves first. And once I have donned my clean gloves, I can go ahead and grab an alcohol swab. And now that I have my alcohol swab, I'm going to clean the site that I chose, so the ventrogluteal muscle. I'm going to be cleaning in a circular motion and working my way outwards, and we're going to be cleaning for about 30 seconds. So we're going to say that that's been 30 seconds of cleaning, and then this can just go right in the garbage, and then we are ready to give our injection. So we're going to allow this a second to dry, and while we do that, we can go ahead and uncap our needle. So for intramuscular injections, I'm going to be injecting at a 90 degree angle while Z-tracking. So now that this is dry, I'm going to Z-track the patient, and I'm going to be entering at a 90 degree angle. And once I've entered at a 90 degree angle, I will go ahead and stabilize my syringe, and I'll inject the medicine. And once it is fully injected, I will go ahead and remove my fingers, remove my syringe, and right away go ahead and activate the safety mechanism of the needle. So once that is activated, I will deposit it directly into the sharps container. And then if needed, I will apply a cotton ball for about 30 seconds, being careful not to massage the skin, although in this case we don't need to apply it as there's no drainage. And so now that we have done that, I'm going to go ahead and explain to my patient that I'll be monitoring a couple things. I'll be taking their vital signs again soon, as well as I'm monitoring their level of consciousness again and their nausea levels after the procedure in a short while. So once I've decided what I'm told them that I'm going to monitor, I'm okay to take off my gloves and wash my hands, and then I'm going to right away sign my MAR that I've given my medication. So I'm going to sign that I've given my diamond hydronate at 2030 and my initials CPUMSN2 for my designation. So I'm going to show that I've signed off in the correct area for the diamond hydronate with the time, my initials, and designation. And now that I have signed off my MAR, I'm going to go ahead and do a quick final safety check of the room. I'm going to make sure there's no hazards anywhere, that their patient is in a safe, comfortable position with their bed lowered and call light in place. And once I have done my final safety check, I'm going to return to the charts and I'm going to document. Now I'm going to document how the patient tolerated the procedure, as well as their levels of nausea, as well as their levels of consciousness. And I'm going to, once I've finished documenting, then the injection is fully complete.